Leukemia literally means white blood, and that is when there are too many white blood cells in the circulation. This can be caused by overproduction of white blood cells in the bone marrow or by the cells not being properly processed in terms of maturing normally in that environment. The main types of leukemia are either chronic, which can develop slowly over months and years, or acute leukemia, which can develop in a few days. The acute leukemias tend to involve, for example, acute lymphoblastic leukemia, younger children, and older adults will tend to develop acute myeloid leukemia. Chronic leukemias mainly occur in adults, and the commonest type is chronic lymphocytic leukemia, which may not require any treatment whatsoever. Different leukemias require different treatments. Some chronic leukemias do not require any treatment and are simply observed over years and may never require any treatment. Other treatments include tablets, and some of these tablets now are targeted to certain abnormal genes in the leukemia cells, and many patients will stay on these tablets lifelong, but with minimal or no side effects, and are effectively cured with the use of a tablet. Other types of tablets involve the use of oral chemotherapy, which can be used for some chronic types of leukemia. The acute leukemias tend to need more intensive treatment, and this usually involves treatment in the hospital with intravenous chemotherapy, which is intensive and often will require regular antibiotic therapy and transfusions. Some patients will also need a stem cell transplant. Stem cells are the cells in the bone marrow that make all the other cells, and stem cell transplantation can allow for a higher cure rate in some of the aggressive types of leukemia. Stem cells are used to allow us to give higher doses of treatment for patients with leukemia and lymphoma. This allows a higher cure rate. Stem cells can be obtained from either the patient themselves or from a tissue type matched donor. In general, using the patient's own stem cells is called autologous stem cell transplantation and is mainly used for patients with lymphoma or multiple myeloma. For patients with leukemia, we tend to use donor stem cells. The source of stem cells can either be a brother or sister. There's a roughly 1 in 4 chance of any brother or sister being a tissue match with the patient. If the sibling is not a match, then we can find alternative donors from either unrelated donor volunteer banks, and there are now over 25 million people worldwide who are potential donors on those banks. More recently, we've been using half-matched family members, so that would mean that any parent or any child of a patient would be half a match, and therefore we're much more likely to find donors for almost every patient we look for nowadays. The donor needs to be a tissue match with the patient, and therefore routine blood tests are done to confirm they're a match. The donor will need to have a routine medical, a bit like an insurance medical, to make sure they're fit to be a donor. Historically, we've tended to collect stem cells from the bone marrow where they are in the steady state. But in more recent years, we've tended to collect stem cells from the blood, which is a much easier procedure. Bone marrow collection involves the use of a general anesthetic and usually a stay in the hospital, whereas collecting stem cells from the blood can be done by giving the donor a blood hormone, which moves the stem cells from the bone marrow into the blood, and therefore the cells can then be collected from the blood, and that's usually done on a single morning as an outpatient. Collecting stem cells from a donor is very safe and usually involves no long-term side effects.